I'm Dr. Jodie Ingalls, and I'm from the Centenary Institute's Molecular Cardiology program, and I'm here with one of our patients, Mark Maxwell, and he is a cardiac arrest survivor, and he's going to tell us a little bit about his story.
Yep, so my name is Mark Maxwell. The way all this happened was when I was 18, I'm 25 now. When I was 18, I was living in Australia, and I was actually traveling New Zealand at the time, but I was training a lot, so I was training about 4 times a day or 7 hours a day, quite intensely for what I hoped would be a career in rugby. And so just doing a lot of weights and a lot of cardiovascular fitness and stuff. And I was always okay, fine coming in from training, and I used to do it every morning, and it's a miracle that this never happened when I was out training by myself. But when I was in New Zealand traveling, I was asleep at the back of a bus, and I started breathing quite funnily, and the guys I was with all thought I was just sort of joking around and trying to draw attention to them. But then they realized that I wasn't able to breathe properly, and they said, okay, something's really wrong. They stopped the bus, they carried me off, and they gave me CPR on the side of the road until an ambulance came. And then when the ambulance came, they gave me, I think, 6 shocks of an external defibrillator, and the doctor turned around and said, there's nothing so far. And then because I was a little bit large, like kind of more padded up, I guess, then than I am now, they gave me one more, and it was that last one, that 7th one, that got a reaction. So I was the fittest 18-year-old you would have met, and no warning signs at all that this might have ever happened to me.
Yeah, it's actually probably surprising, but not having a cause for your cardiac event is not that uncommon. So we see a lot of patients that come to us who've had a cardiac arrest, or even families where there's been a sudden death, and in a lot of cases no underlying cause is found.
Even with like young and fit people?
Especially with young and fit people.
Right, okay.
Yeah, in fact we've recently done a study across all of Australia and New Zealand, and we showed that in young people the most common cause of a sudden cardiac death, so that's a cardiac arrest that isn't able to be resuscitated, is actually unexplained in 40% of cases. So those families have no cause for their young, fit, healthy family member dying suddenly. Yeah,
well, that's what I found interesting, was that you look for the kind of trigger signs of what you associate with bad health and cardiac arrest, etc., as being maybe like gross obesity or smoking or anything like that. None of those were there, but a fit and young person it happens to. So yeah, it's surprising.
So the hard thing is for a lot of patients and families is not having an actual diagnosis, and it can cause a lot of uncertainty.
That's been the case with me. So I have been to doctors in Ireland, England, Australia and New Zealand, and like 4 very good doctors, and still no set diagnosis. None of them have agreed on one diagnosis. Now I've got an ICD, so that's been helpful to me and has actually saved my life 4 times already. But so I guess the concern of me not having a diagnosis has gone away now, because I know I'm sort of okay and I'm doing the right things. But the big concern for me is when I eventually have kids, if I'm undiagnosed, I don't know what to look out for in them. And that's why, as I was saying, like, it's what you guys are doing, what the genetic team are doing, that I'm really interested in, because that's that's the most important part of it for me.
Yeah. So we've had our clinics running for over 15 years, and we see families and patients like you every day, and so part of what drives our research really is to get answers for people like you. So we have the Australian Genetic Heart Disease Registry, and this is something that I set up during my PhD with Professor Chris Samsarian.
Right.
And this aims to enrol every Australian family with an inherited heart condition. So far we've got about 2,500 people enrolled, and they have a range of different inherited heart diseases. And I guess the main aims of it are to provide education and create a bit of awareness about genetic heart diseases and sudden cardiac death in the community, and also to have a big database available to do research studies to understand things like why young people die suddenly, what are the risk factors, how can we better manage and treat patients, and probably, I guess, one of the key things in your situation is how genetic testing can be helpful when there's no clear diagnosis, because sometimes these things aren't that obvious in your heart. But looking at the DNA, we can find things that might explain those symptoms.
Yeah.
So
just thinking selfishly, it's in my interest that the more people who have genetic cardiac problems or cardiovascular problems come to you, because the more data you have, the more people you can study, the better chance you have of solving each individual case.
Yeah, and we're really lucky that from here we've got so many really good collaborators around the country. So we've got recruiting sites in Adelaide and Tasmania and Melbourne and Brisbane.
Right.
You know, so there's a lot of people working on this in the background at the same time.
Yeah, and it means a lot to a lot of people, including myself. So we definitely appreciate it, and the more the merrier.
Thank you so much for coming in and telling your story for us. It will help a lot of other families.
Yeah, thank you guys for doing what you do, because myself and those families are counting on you. So thanks.
Thank you. Thanks.